The broad use of mammography in Western countries ended up being one of the largest public health experiments ever done. And the results are unequivocal. In every community around the world where mammography has become a standard component of screening, the mortality for breast cancer has fallen. So there's no doubt that one of the most easily available, least expensive, broadly useful tests that we have to prevent death and disease in the form of breast cancer is to go through screening mammography. By the way, in contrast to most cancer screening, it's remarkably effective. We actually do not have similarly effective tools for many cancers. The question, the specifics about what age to start and the specifics about how often to do it, and your question about when to stop, that actually is a little bit harder to answer. And I say that because, you know, honest scientists can disagree about this. The United States has been at the one edge of the spectrum, recommending early use of mammography as early as age 40, recommending it yearly, and recommending it, and this is the fun part, until about 10 years before your anticipated death. So,
keep going.
Make your point.
Right.
Keep going.
So, yeah, that last part's always the interesting one, but that's probably as good a job as we can do right now. And I actually would just, because there's an anticipation of a next question, when one starts to talk about scaling back, one is talking about rationing. And that may or may not be what we end up doing collectively, but I would put mammography far down on the list of interventions that I would cut. There are a lot of things that go on in the society that are far less fruitful than that.
Exactly.
Okay, I just want to add one other thing to that just before we close, is that in terms of stopping at a certain age, it's not just reducing mortality, it's reducing mastectomy. And so detecting a cancer early when the breast can be conserved is also a commendable role for breast screening. And so the idea of stopping at any particular age is something that I think should be questioned by people who are trying to reduce the incidence of mastectomy as well as mortality from breast cancer. Yes, well, all right. The recommendation is start at age 40 and do it once a year for the rest of your life. Yes, and that's we're having a lot of rumbling. It's interesting that it took us that long to get to mammography. It's usually the first question that really comes up in that regard.